Hello, my name is Hyunju Song, and today I'll be presenting about RAD Translate, which is a digital tool that we've developed that utilizes artificial intelligence-powered multilingual speech in order to enhance the quality of care for patients of limited English proficiency. When there's a big surge of patients who don't speak English well in the urgent care setting, it creates a higher demand than the supply we have for human language interpreters. This dependency on interpreters reduces the clinical workflow, and language barriers may also hinder timely and efficient communication, which may result in inadequate preparation for exams, which then in turn impacts the image quality and thus may increase health complication risks for the patient. So overall, the patient leaves urgent care with a poor experience as well as a decreased sense of health literacy. In a contemporarily relevant context, the COVID-19 pandemic has significantly increased demand for chest x-rays and interpreter services. It's crucial to note here that COVID-19 has also disproportionately impacted individuals from communities of color, as well as immigrant populations. And these are also the very groups that demonstrate limited English proficiency, and thus may have poor patient experiences due to the circumstances that I've mentioned in the previous slide. Therefore, we see a clear need to create one-way instructions for high-throughput imaging exams, specifically chest x-rays, to assist in the workup of suspected COVID-positive patients. And our solution to this was RAD Translate, which is an artificial intelligence-powered digital tool that provides audio instructions for patients in their native language for each exam. This tool is free to use, device agnostic, and is easily accessible, requiring no download. Currently, the 4 exams for which we have specific instructions available are chest x-rays, mammogram screenings, COVID screenings, and falls risk screenings. The implementation cost of RAD Translate is minimal, with a total cost of $123. The tablet and stand are both available on Amazon for $65 and $58 respectively, and can easily be put together. And this is the user interface of RAD Translate. You've probably noticed the QR code at the bottom of each page, and this will lead you to RAD Translate's homepage. When you go on the page, you'll notice that the site is categorized by exams and then by languages. There are large buttons for visibility, and the website and audio load relatively quickly so that patients can communicate quickly and efficiently with their care providers. Currently, there are 5 languages supported by RAD Translate. They are Spanish, Portuguese, Mandarin, Korean, and Italian. We also have Arabic and Russian in development right now. There's a lot more going on behind the scenes than just a few buttons, however. The first step is to collect standardized phrases for each exam from technologists, radiologists, and ancillary staff, who then send our team their scripts, which we then send to our interpreter services at MGH. When we receive the translated scripts from the interpreter team, we use a neural text-to-speech program to convert the textual instructions into clear audio instructions. And this final recording is reviewed for accuracy and clarity by certified bilingual staff members, and then uploaded onto our website for our patient and provider use. This is an example of a script we have for a falls risk screening. The English instructions are on the left, and the Korean instructions are on the right. We implemented a pilot trial for RAD Translate in the Chelsea Urgent Care Clinic, which is predominantly frequented by Spanish-speaking patients. And for this specific trial, we only used RAD Translate for chest x-ray instructions. The purpose of this trial was to see if we could successfully integrate RAD Translate into the clinical workflow of technologists, and to evaluate whether or not RAD Translate could help decrease imaging appointment duration or even variability in appointment time. There were 6 non-Spanish speaking technologists that we work with, and each technologist received a tablet fixed to a mobile stand, much like what you saw earlier, and the tablet was connected to a Bluetooth speaker to increase audio clarity. There were a total of 117 patients in this case study, of which 18 were instructed using RAD Translate, and 99 were given instructions by a human interpreter. This distribution of patients by each performing technologist is shown on the left, and the imaging appointment duration for each group is shown on the right. Imaging appointment duration was measured as the time difference between when the patient was first marked as arrived on Epic and the time the technologist marked the exam as having been complete. As you can see, there is no significant difference in the average IAD between the RAD Translate group and the control group. However, variability in IAD was significantly reduced in the RAD Translate group. And 2 weeks after RAD Translate was implemented, we surveyed the technologists about their experiences with human interpreters and RAD Translate. All of the non-Spanish speaking technologists switched exclusively to RAD Translate, claiming that it was user-friendly, effectively reduced delay in caring for limited English proficiency patients, increased efficiency, made their jobs easier, and made for an effective addition to their clinical workflow. Following this implementation, all non-Spanish speaking technologists adopted Rad Translate. We analyzed the amount of visits on our website as well as the clicks on each phrase, and some of the most common phrases are listed here, with "what is your full name" being the most common phrase and 35% of all clicks. However, we recognize that our work here is not done. There's a lot more to work on, especially in expanding support to other departments outside of radiology, such as pediatrics, anesthesia, emergency medicine, and so on. We also hope to expand our tool to integrate consent forms in patients' native languages, as well as to integrate more languages into our website. This is our team. Mark Succi is the attending radiologist, as well as the director of the Mesh Incubator who created Rad Translate. And Dan Chanda is also a resident in radiology and is a resident lead on this project. They are the creative minds that worked hard to make this all possible. And I was recently recruited as a project manager and have joined the team this previous fall. Well, thank you so much for your attention. And now I would like to open up the floor to any questions you may have.